And I don't wake up in the morning hurting anywhere, and that's after having 13 hours of surgery on my left arm and rib cage from a really, really bad accident in August of 2020 when I was on a men's adventure group out west. And I credit the things that I do every day to that,
Friends, welcome to the Decentralised Health Podcast and to episode number 7. Today's guest is a dear friend of mine, Dr. Thomas Cabell. Thomas is an invasive cardiologist based out of Nashville, Tennessee. Since high school, Thomas has always been about the optimization of health and performance. Through college and medical school, he knew that there was a better way than the current paradigm, but for years it was just about the right nutrition and right exercise. However, since 2022, he has come to understand that visible and non-visible light rules it all, and the science of quantum and circadian biology has blown his mind. Personally, light, circadian rhythm, and cold therapy have helped him heal his own autoimmune response without any medication. The power this information has to leverage nature to optimize our biology for optimal health, performance, and longevity is truly astounding. And while working as an invasive cardiologist in a mainstream healthcare setting, he is now on a crusade to educate his patients and other healthcare professionals on this incredible science and its powerful principles. So friends, welcome to the Decentralised Health Podcast and to Dr. Thomas Cabell. Thomas, brother, welcome to the Decentralised Health Podcast. How are you? You well?
I'm great, man. I'm great. It's good to be here. Glad to see your face. It's been a few months.
It's been a long minute. December, 4 months now. 4 months since we last saw each other. How's life been? All good?
It's been great. It's we try to say at our house things are a blessing, not a burden. We have 4 teenagers, all of whom are really good athletes. Our oldest son's doing football recruiting as a junior in high school. Our freshman son's doing track and 7-on-7, and we have 2 girls that are doing travel volleyball. My wife's actually in Philadelphia right now, and I'm in Nashville. Wow. So it's a lot.
Wow. Yeah. Okay, so they're clearly taking after you. That's the thing there. They've got your genetics clearly.
They take after their mom. I'll tell you, she's an incredible athlete. So I just gave them some height, maybe a work ethic, is what I tell coaches. So
yeah. Oh, dude, I'm sure it's more than that. But thank you for spending the time. I know you're an incredibly busy man, not just with your kids, but obviously with the job that you do. So Let's start at the beginning. Let's start your hero's health journey. Talk to people about your experience, who you are, what you currently do, and how you got into all of that.
Well, first, thanks for having me on. I've been really excited. My kids are even excited about me doing this. So I'm the oldest of 4. I grew up in Mississippi. Was raised by a single mom. She worked really hard. She worked 3 jobs a lot of times to keep us in school and keep us in the things that our friends and stuff had. And I had, I would say, a fair bit of adversity as a kid. Grew up in a neighborhood that I would say wasn't very safe in many ways, and had a lot of asthma and allergies. And it wasn't until much later in life when I found Gabor Mate that I kind of started to put things together and understand how a lot of the things I'd experienced as a kid, like one quick story, we were staying at my dad's one evening, and the babysitter was there. My dad had gone out, and we were like wrestling with my brothers, and I have a younger sister. And all of a sudden we like heard this noise, and we turn around, and standing in our living room is a woman with a gun pointed at us. And I mean, I was probably 10 years old, and we had to kind of like talk this thing down. And like, she was mentally very unstable, was one of our neighbors, and just a wild kind of time.
Wow.
And so it wasn't until much later that I started to kind of wrestle with a lot of the things that I had experienced growing up, and started to kind of unravel a lot of that trauma. And going back to kind of elementary school, junior high, I was a really smart kid, but I was relatively sickly early on. Like, I would play soccer, but they would put me at goalie because I couldn't run the field because my asthma was really bad. And And as I grew, I remember 7th and 8th grade, just like really having an affinity for books and learning, and especially science. But also realizing that I was kind of the classic nerd. And I kind of saw sports and athletics as a way of becoming accepted. And so I started basically just applying things I could learn. So I was not the most, I would say, gifted athlete, but I was smart and I could read and I could say, okay, well, what are these athletes doing to get better, and how can I use that? And so I just worked really hard. I have 2 younger brothers. I always joke with people, if you're an American, you would know who the Manning family is. And I always joke that I'm the Cooper Manning of my family. I have 2 younger brothers who were really phenomenal athletes, and played college ball and everything. But I just worked really hard. And so as time went on, hilariously enough, I graduated high school most athletic, and went on to do engineering in Mississippi State University. And then kind of decided halfway through that I was going to do medical school. My dad's a physician. My mom's younger brother is a surgeon. And through doing Boy Scouts and things like that, I was always really good in emergencies. We had a number of things happened, with Scouts and doing adventure stuff. There's always like wilderness emergencies. And I just always had done really well in those kind of situations, always stayed really level-headed and was able to kind of assess things and make good decisions. And so medicine seemed like a good option for me. And at the same time I was going into medicine, I was also like, I literally came this close to being a chiropractor, because even in college, I was already like, this whole healthcare idea that everybody needs pills in order to be healthy, it just made no sense to me. And I just intuitively believe that humans are our God-given birthright is to be healthy and have vitality and have optimal health. And I just felt like like the cart was before the horse type of situation. So I almost went the chiropractic route, because I'd had a good experience with a chiropractor that was local to us, that had helped me with some things. And but ultimately, just because of the way my family was structured, it was kind of a very performance-based family. So if like you weren't a professional, if you weren't a physician or an attorney or a CPA, you were like a second-class citizen. And I ended up going to medical school, and same kind of things applied. I actually went to Europe for 3 months before medical school, backpacked by myself. It was probably the best thing I'd ever done. And it really just opened my eyes to the world. And so when I came back and tried to go to medical school, I had a really hard time burying my nose in a book at that point. But I did well. And I had worked in cardiology for several months before I went to medical school. Because I had actually, so backing up a little bit, I had gotten a full ride to medical school the year before. And I went and met with the dean of admissions, and I said, hey, thanks. I'm not really sure I want to jump on this train, because once I'm on it, I can't get off. Because I knew, just from my dad and my uncle, like you start medical school, you do residency, then you go to work, and you've got debt, and like, your life is in many ways not your own anymore. It's different from the UK, where everything's are paid for. A lot of people take on a ton of debt to go to medical training. And she said, I totally get it. I think that's a really wise decision. The other thing too is I had worked in several areas each summer. So each summer between college, I worked in pathology, doing autopsies and running the labs. I had worked in radiation oncology. I worked as an orderly one summer at a local hospital, just helping surgeons. I'll never forget a friend of our family was a surgeon, and I was in the room before they were getting started. And he was like, hey, Thomas, you know what the worst part about taking call every other night is as a surgeon? And I said, I have no idea. And he said, you miss half the cases. And I was like, oh man, like, wow. That's not me. So it just kind of like, I wasn't sure what I was going to do. And she very wisely was like, I think you'd make a great cardiologist. So she stuck me with the cardiology group for several months. and they really paid me just to walk around and help them out and do stuff. I mean, it was a great job. And then that following March, so I was supposed to enroll in August, I deferred. And then that following March, I went to Europe and did March, April, May. And then the following August, I started med school. And pretty early on, just knew I was going to do cardiology. And I was kind of the EKG guru for the class. So they would always bring me stuff. I had already read a lot of EKGs by then, actually. And yeah, I got done with medical school, went back to Europe for 2 months. I matched at Vanderbilt and did a residency there, and then met my wife, who finally agreed to go out with me after 3 different tries, 3 years apart. And then we moved to Florida, did my fellowship. We had our first son, came back here. And it was after our 4th child, I think, that she started having some health problems. And so that was when I first came across, this was years ago, 13 years ago or so. I came across Rob Wolf and Lauren Cordain and paleo, and I had been into performance and nutrition. Like that was stuff that I'd tried every supplement known to man, I think, to put weight on or get stronger or get faster or whatever. And I started just going down those rabbit holes, a lot of the stuff that Rob wrote and all that stuff, and it just made so much sense. And so we started making those changes and started seeing big improvements. And up until then, after playing a little bit of college football, my brothers and I got into triathlon. So we were doing hardcore endurance training. We were pounding carbs all the time. And I just could never really get lean like I thought I should be. So we ended up going paleo for a while, and then it's just kind of evolved from there. I think it was like 2016, 2017, I came across Jack Kruse.
Yeah.
And I remember reading something about time dilation, mitochondria, time machines. And I remember trying to read his stuff. I was like, this guy's either a complete wackadoodle or he is so far ahead of everybody else. Yeah. Just like when Einstein was discussing relativity in the early 1900s, like 3 people in the world knew what he was talking about.
Yeah.
And it just kind of and then I think I refound him during COVID, probably a year before the Huberman podcast came out. And I was trying to kind of catch up and read through his stuff. And at that point, it made so much more sense to me. I don't know if I had just been exposed to enough by then that it was all starting to kind of come together. But once I, like so many people, I think once I heard kind of the whole continuum on Huberman, it just, so many things dropped into place. And I was like, oh my gosh, I've been wrong this whole time. What am I doing? And how could I have not seen this before, right? This whole story around light, electromagnetic radiation, and the way our biology works. And so once I started kind of realizing that food was not it and movement was not it by themselves, and that light really trumps or is the foundational element of all these other things, that's when it really started to come together. And I've kind of been proselytizing ever since. As a side shoot or side story from this, in 2015, I did kind of a men's leadership intensive, and it was in that week, which, they would say these intensives are like doing 1.5 years of therapy in 5 days or whatever. Wow. That I started to get an idea of like how broken I was, like how codependent I was, and just emotionally in many areas not mature. Even though I was a cardiologist and really good at what I do in relationship, I thought I was doing well, and turns out I wasn't. And so that was in April of 2015, and then I started doing some really intensive work, and then did more intensive work for a few months away from my family in January of 2016. And the reason I'm talking about all this is it kind of pulls everything together for me in terms of how I look at patients and people. it was after that experience that I really started. I didn't have the term for it, right? I mean, people who probably watch this know about Olivia Lessler, and oh my gosh, she's just amazing.
Yep.
But the psychoneuroimmunology,
Yep.
the P&I part of the health story, and I didn't know that term at the time. I just knew that if you have unresolved trauma and unresolved emotional issues, they drastically affect your physical body.
Yep.
And that was a lot of my own story. And working through a lot of the things that I did opened my eyes to so many people coming in to see me for things that weren't really physical. They were emotional and mental, not in the way that like, oh, you're mental, but,
Yeah.
but like in the way that like,
mental in nature, where it's coming
from.
Yeah,
they're nervous system issues.
Yeah.
And I got really good at picking that up in people. I had a lot of stories of particularly young women would come in and I could just almost feel their energy. And I remember talking to one girl and her boyfriend was in the room and I started saying these things and she looked up through her sunglasses and she was like, how do you know my story?
Wow.
And I was like, cause I probably have something similar, you know?
Yeah.
And a lot of these times it's palpitations, it's chest pain, it's shortness of breath. It's kind of the anxiety like attack that people don't ever want to own, which is the body's way of trying to release a lot of this emotional energy that's just never had a place to go. And we see that a lot. I see that a lot in practice, and it went up an order of magnitude after COVID. Not just the physical trauma of COVID, but the emotional, social aspects of what it did to people's psyche has created a tremendous amount of health anxiety and a lot of just issues that are not necessarily springing from an organic cause, but there's a mind-body connection that's driving that, and that work has to be done. And so then I got partnered up through my therapist, had gone to school with a woman who had started a nonprofit here in Nashville called Refuge Center. And because I had talked to him, so I was like, do I need to start a foundation? Like so many of these people need counseling. And, you know, they've got all types of terrible stories. And most of these are people who don't have the financial means to go and get the help they need. I was fortunate. I had the ability to go and do the deep work. And I'm super grateful for that. But it was like a lot of these people don't. And he said, well, maybe before you start a foundation, why don't you talk to this person, Amy? And we hit it off. Like we talked for an hour and a half the first time. And I started funneling patients to her, and they would come back to me, you know, several months later, like completely new people. And they were like, how did you know? Like, this has been life-changing. Like, and I'm just thinking, there's not many cardiologists who have this approach, right? That was at the time where I was not only doing just the standard allopathic medical model of, you know, diagnose and treat kind of stuff, but a lot of times I was playing therapist, not officially, but just like, hey, I hear this, and what about if you thought about it this way, or what if you went and did this work, or, you know, I'd refer people for EMDR and things like that. And that was super rewarding. And then, like I said, roughly maybe 2 years ago, started really just I don't know, my psyche is I'm always trying to optimize. I'm always trying to, there's always got to be a smarter way to do things. And when it comes to health and wellness. And so I'm just always looking and reading. And so I just started coming across all the stuff with quantum biology and light and everything. And now, like today, it's like I pull all that in, which does make it really tough in a normal medical model to kind of talk about all this stuff. But we typically, if I'm seeing somebody, you know, I've got one set of tools, which is kind of the emotional, mental aspect of things. And then I've got like the quantum biology set of tools that we can utilize. And then I've got medication if it comes to that. And that's kind of the model that I have right now. And I think it's been really rewarding. We've gotten, you know, I'm way more busy than I want to be. And so, which is a good thing to a point. But I think now it's like becoming a frustration that I want people, because of how I grew up and the things that I experienced, I have this overdeveloped sense of injustice, let's say that. And I just see people suffering and going through things, I won't say needlessly, because I do think suffering in all its forms with the right mindset is something that brings a lot of growth. But there's also a lot of suffering that doesn't really need to happen if people knew how to do a few things well. And I think that's where I get frustrated with our system. I work in a really big health system. The hospital I cover has, I don't know, 600, 700 beds. It's enormous.
Wow.
And it's just lines and lines and lines of really broken people. I mean, just, in more ways than one. And it just breaks my heart every day I go in there, because I'm just like, we spend, 2x more money on our healthcare than any other country, and we're 30th in results. And nobody wants to talk about it because everybody's profiting from it. And I think that I get really frustrated, and it's just this constant tug of war in me, to whether to leave that system and go do something else, or try to stay in that system and try to change it. And I think that continues to be a struggle for me. And that's my own work I've got to keep looking at. But that's basically kind of the story in a nutshell, if that helps. And so, the types of things that I've dealt with, I developed, when I was going through a lot of the trauma work back in 2016 and 2017, and I developed psoriasis in my scalp and a little bit on my skin. And I was like, okay, something's triggered this. And, the more I was able to take a deep dive and start to understand, well, part of it's my light environment, a lot of it's my stress and just my emotional issues I'm going through and dealing with my family and all those kind of things. And today it's basically non-existent. But it's taken a long time to try to unravel a lot of what, for me, is the things that are triggering for that. And everybody, I think everybody's a little different. Everybody's got different aspects of this stuff, but we know autoimmune disease is clearly on the rise. I think the last I read, like 1 in 4 Americans, which is just unbelievable today.
Yeah. Before COVID, it was 1 in 10.
Yeah.
And now it's 1 in 4.
Now, either between vaccine or COVID itself, it's worse. And I've had some flares since all that started, so it's definitely plays a role. But I've never been on medication for any of it or anything, and I'm not on any meds. Like, I don't, my blood pressure is great, and I don't really worry about my lipids. Calcium scores are great, and all those kind of things. And so I think for me, a lot of it's doing the emotional work, just trying to continue to heal and do things like that. And so I'm really grateful. Like, Nashville's got a great kind of community for that. And I have a pretty crazy, like, there's not many cardiologists who've been on the medical advisory board of a psychedelic medicine company, on the board of a nonprofit for mental health. I'm on 2 or 3 other startups for medical devices and things like that. I like the entrepreneurial business side of medicine. But I also like, I think there's no replacement for one-on-one with a human being. And so it's a hard balance. Probably my best visits during the day are the people that I connect with, and I get them to understand that maybe you're not dealing with a physical heart problem, but losing your mom when you were 18 years old because of this thing happening and never really having the time to deal with it. And now you're getting close to her age. Let me tell you how that starts to affect your nervous system and kind of these retained memories and epigenetics and all those kind of things. And so that's stuff. And I think people are really hungry, intuitively. I think people realize this is not how it's supposed to be. And a funny story too, like I know I'm bouncing, but
No, please bounce away.
So as a senior fellow at University of Florida, you give kind of a senior grand rounds to a lot of the faculty and everything. And for me, instead of talking about ischemic heart disease or valve disease or peripheral vascular disease, I gave a lecture on the history of modern medicine, beginning with the mid 1850s on through the Flexner Report and how we basically got a socialized system. And I was the only one who was asked to come back and do part 2.
Wow.
So it was a fascinating kind of like most people in medicine have no idea how we got the system we have and why we focus on the things we do. It's the same thing with like the food pyramid. Nobody goes back and looks to see who funded the research that led to the things that the government promotes. And most people are just, and this is not a shameful or negative pejorative, or just ignorant of these things. And so I think it's just when you start to become aware, that's when it all kind of, the smoke clears and you can see the island better. And I think we were the group of people during COVID. My wife is a nurse practitioner, ran the Vanderbilt ER. And, we were extraordinarily leery. We both were like, how many times in medicine have they said, this is a great idea? And then 5 years later, they go, oops, we messed that up. And I was like, thousands of times we have done that. And so this whole like rampant embracement of, the mRNA vaccine or whatever it is, just always gives me pause. And so that's kind of the background, I guess, if you will.
No, brother, thank you for sharing that. And there's so many points that we can pick up on that. And I think, as you're saying about the medical model that we currently have right now, like the one thing I always say to people is incentives dictate outcomes. Mm-hmm. So please don't take everything that you hear or read, particularly in the media, as the truth. Because again, incentives dictate outcomes. Why are they saying these things? What's the overarching goal of them saying these things? Like why, if we look back at kind of how lockdown and COVID happened, now knowing that Fauci was saying, oh yeah, I just made up the 6-foot rule, because what virus obeys to a 6-foot rule? What virus says, oh, okay, so you can go to a restaurant, but if you're standing, I'll infect you, but if you're sat down at the table, I won't? None of this makes any sense, but nobody questioned it.
Yeah.
So I think the true measure of an educated mind is to be able to hold opposing thoughts, not aligning with any of them, but doing enough of your own critical thinking to say, like, right, so who said this? Why do they say that? What's the reason that they said that? What do they gain from saying these things? And I think having somebody like yourself in the system has tremendous amount of merit, because you're questioning those things, and you're not doing it in a riotous way where you're trying to like take down the establishment and all that type of stuff. You're trying to change it from the inside out, and you're doing it in a way which is actually working. And I think that's a tremendous place of power, because so many people, maybe colleagues of yours as well, I don't want to shame anybody here, but would just normally just say, oh no, I'm not going to say anything. I'm just not going to say anything. Like I had Rachel Maurice on, and she was saying, like, during COVID, she was challenging the push. She was challenging the vaccine in the hospital she was working in, challenging the masks. And everyone's saying, oh no, I couldn't, I'm not going to challenge that. You shouldn't be saying stuff like that because you'll get in trouble. Well, at what point did freedom of speech have an issue? Like, we should be able to say these things. We should be able to question these things. Like this whole, oh no, you can't say this, you can't say that. Oh, I'm triggered by this, I'm triggered by that. No, this is an opinion. I'm allowed to have an opinion, and I'm allowed to think about this critically. And I think what COVID and lockdown did for a lot of people was removed their capacity to critically think, because they were waiting on tenterhooks for the government to tell them what to do. Like, tell me what I can do. Like, oh, I'm staying inside again. Okay, fine.
Yeah.
But nobody ever questioned it. Okay, so they're stopping us from socializing. They're stopping us from going outside in natural light. They're stopping us from an immune response, which is natural and innate.
How insane was that? Like, they're arresting people being on the beach. Like, it's just, it's ludicrous. And yet people, I think, gosh, I can't remember now, Jack just did a podcast with Alexis's business partner not long ago, but he talked a lot. I mean, and I think this is obviously well known that fear is such an incredible controller.
Oh, 100%.
There was so much fear around COVID, and the media just played into so much of it. And I kept saying, I was like, guys, this is not the pandemic we've been worried about. Like, smallpox killed 1 in 3 people and had a much higher infectivity rate than COVID did. Like, COVID was basically a new flu. Like, when you look at the numbers, and we already knew that. Like, it's crazy to me. I was seeing patients in the summer of 2020. And I was reading my note that I was going, like, there were patients I was going to see in my office in June and July. And I'm reading my note from November, December. And it says something like, they've been struggling with a really bad viral infection. It's created this, they've lost their smell, blah, blah. And I go back in the room in like July and I go, you had COVID in November of 19. And they're like, I did, and we're like, but it wasn't supposed to be here yet.
Yep.
And then you read like, who is Tom Seeger's partner, AJK, had done this whole expose on COVID had probably already circled the globe once or twice by the time that we were all hitting the panic button. But I think to the point, like, fear just shuts off so much for people. And they don't want to critically think. They can't do it. They want to be told what to do. And I it's just, I don't know. That's just not how I'm wired. No. And it's just, it's wild because you'll see, even in families, you'll have 1 or 2 siblings that think this way, and then another sibling that's this way. And you're like, you were raised in the same family, the same parents. How did that happen? And I'm not saying it's good or bad. It just creates all this friction. I mean, to this point, there's been no real apology from all of the people. I mean, there's some things happening here and there, but people that were like, hey, I'm just suspect of this thing. Like, I'm not saying it's not a good idea. I'm just saying I want to wait. And yet that was demonized. And that to me is that was our stance. That's a very rational stance, I think. And yet it was completely frowned upon by the powers that be. And to Rachel's point, like, she and I talked about that when we were in El Salvador. I wanted to be more vocal than I was, but I'm also in a position where I had kids in private school and kids in public school, and I have 4 children. And it was like, I can't afford to be basically out of work. My wife and I years ago made the decision that I was going to work and she was going to raise the kids because we felt that was the most important thing we could do. And she's a fully capable, extremely talented nurse practitioner who could easily go out and earn a living. But, we both felt like raising children was our priority. And so I'm the breadwinner for the moment. I always make the joke, I'm just the bank. She's the CEO. And
as all good marriages should be.
Right. And so, it put a lot of people in a situation where I think there were a lot of physicians that wanted to speak out. I have a lot of friends that were on that side of the fence, but at the same time, they were basically muzzled because of the power that the boards have and the state licensure and all that stuff has. And, I didn't know a lot of the history. Jack has obviously, as he does so well, kind of enlightened me on all of the prior history with this stuff. And it's just, it's just amazing how much we don't remember and how much we forget. Just as a culture, the things that aren't carried forward that have such an important role on why we do the things we do today. That's he's one of the, I say he's a 1 in 500 year mind. Like he's just, I've never heard anybody like him. And I hope to get punched in the mouth one day because that means at least he's seen me. But I try to absorb, as much as I can. But I think the political history is just as fascinating many times as the quantum biology that
I agree.
That he's teaching.
You have to know both. I think that's the most important thing. And as much as it's because of obviously where he was born and where he's coming from, a lot of it is American history. But when you listen to like the Danny Jones podcasts and you hear, you hear him connecting it to British history and European history and taking it really far back and joining the dots forward. You're just kind of like, wow, like this machine has been running for a really, really, really long time.
Yeah.
And it makes you start to question that paradigm in not a conspiratorial way, but in a why didn't they tell us this? Why have we not been told this? Why has this? Because whenever something's kept in secret, you have to then again ask that question, why? Why aren't they telling us something? Like, why wouldn't we be allowed to know that? And I think I'll put all of this in the description for people that don't know who Dr. Jack Kruse is. I'll put a more basic podcast in there that people can listen to, because he is, like you mentioned his blogs, like he's been blogging for 15 odd years. It takes about 17 hours to read one, and that's just to read it. It's not to understand it. That's just to read it.
It's just to read it. I mean, he's prolific. I literally have no idea how he does what he does. I'm like, I don't know
where he's in his brain. I really don't. Like the memory he's got is I swear he's got an idemic memory, because there's no way that you be able to remember and bearing in mind, he's been a spinal surgeon, a dentist, and he's a neurosurgeon. Yes. And yet he's got probably better historical knowledge than most people on this planet.
Most historians.
He's got better knowledge of the history of the UK than I do, and I'm from the UK. So I think what I'll do is I'll pop in the show notes, like in the description below, a good easy podcast to get into, and then I'll link him to. There was one he did recently. I forget the name of it. It was a really, really good one where he went into the kind of like the Cambrian explosion again and all that kind of stuff, and the general oxygenation event and all that stuff, the GOE. Right. And then I'll link the Danny Jones podcast as well, so that then people can dive into whichever area that they want to go. Again, please remember, again, you have to, he always states this as well, like, do your research, listen to what he says, and then do your own research. That's
what I love. I mean, Jack's never trying to sell you anything, and he's always going to say, this is not the gospel according to Uncle Jack. This is what the papers say. This is what the science says. And he's changed my life. He's through the work that he does, he's changed hundreds of people's lives that I talk to as patients.
Exactly. It trickles down.
Yeah, it all trickles down. And I tell all my patients when they come back in and they've done the circadian rhythm challenge, or they've done some aspect of the things that we've talked about. And I'm like, great. Now you go be a samurai and you train your people, right? Yep. And they're like, I'm going to go tell my friends. And I'm like, great, because it's the only way we're going to change the system.
Yep.
And I'm super grateful for all the work he does. I can't even keep up. Like, there's more podcasts coming out all the time, and I'm like, Jack, when do you have time to do all this?
I know. And you got to remember, he's in his mid 60s as well, and the guy is not slowing down. He's just getting faster. He's getting faster and more knowledgeable, which is insane. Like
he's just remarkable. I just, and I'm thrilled. Like, I've gotten to get to know Alexis Cowan and Kelsey Dexter and Stephen Hussey and you and Olivia and kind of the OGs in this field. And it's just, man, it's such a gift. I don't know. I hope that we can start to really shift the process for people, because it just shouldn't, I'm just like, it shouldn't be this way. The number of people, especially like in rural Tennessee where I live and work, it's just, the system has just crushed them. And, between big food and big medicine and no education around healthy living, right? Yeah. I just feel like that's completely off the radar. It's like when Casey and Callie Means are talking about, you've got lobbyists trying to get 12-year-olds on a GLP-1 and spend $1,500 a month of government money. How about we give them real healthy food and let them go outside? Like, elementary and middle school kids get less time outside than prisoners. Like, what are we doing?
Yep.
And again, I think so many times it's not malfeasance, it's just ignorance. And so the people in power are serving themselves in a way. And I think most physicians they're grinding. Like, if it weren't for podcast and windshield time, I would never have a moment to really sit and read stuff between the activities with the kids and trying to be present when I am home and be with them. There's just no bandwidth. With the amount of work and the amount of people I see, because I'm a little unusual. I do clinic every day of the week. I don't do procedures anymore. And so I'm in clinic seeing patients all day, every day. And that creates a ton of administrative work, especially for me, because I'm teaching them all these things that are kind of not in the normal lexicon. So then I have a medical assistant that's been with me for about 12 years. And, I'll get a new patient. I check a whole lot more labs and look at a whole lot more aspects of things than most people do.
Mm-hmm.
So that creates a whole lot more questions from patients, right? So I'm punishing myself because instead of keeping it very simple, oh, your cholesterol's high, here's your medicine, next. I'm like, let's check a whole bunch of cardiometabolic and genetic markers to see what your risk really looks like. Then we can make some other adjustments. Here's some things on lifestyle you need to start incorporating. Here's some things we can talk about, maybe supplement wise or no, or what have you. And then we'll make a determination about whether or not medicine's reasonable. And so doing that multiple times a day just creates a much bigger load on us. So most people, physician wise, they have a great heart, they're well-meaning, they're trying to do the best by their patients, and they don't have time to lift their head up and look around and really start to go, maybe there's more to the story than what I've been taught. And we get into this all the time. I was talking to a functional nurse practitioner the other day. I see her husband, and she was like, will you come on my podcast? And I was like, sure. But she was just getting to this idea. She goes, I have people whose cholesterol is sky high in their 50s and 60s on no medicine, and their arteries are completely normal on like a CT scan, we'll say. And then there are people with amazing numbers on paper on no medicine who are just eat up, like they have terrible disease. And so critically, you'd think, well, okay, if cholesterol is the problem, how is this happening, right? And that in and of itself should be enough to make you question a lot of what we're doing. And I think there is that thought, but it's like that creates a lot more work and a lot more effort and a lot more like I'm trying to do on a daily basis. And there are days when I get into clinic and I'm behind and I'm like, why am I doing this to myself? Why am I ordering all these labs and having to explain all these things to people? And I could just get this lab and do this thing and move on. And, and I don't, because I couldn't live with myself, which means I've got to figure out a way to balance it better. That's my work. But I think the majority of physicians and healthcare providers are trying to do the right thing. But there's this whole idea of this top down, the way Jack describes it, centralized medicine. We want to build a decentralized network where people take back their agency and ownership of their health and their finances and their lives. And I think the world's moving in that direction. I think we're in the growing pains of a huge transformational shift across multiple disciplines. That is all shifting. And it's fun to be, involved with a group like you guys to kind of hear new stuff and bounce things off of and learn. And I mean, I will say all the time, the more I learn about this stuff, the more I realize I don't know jack. I just don't know anything. And the things I thought I knew were wrong. And so it makes the practice of medicine a challenge, and I'm super grateful. Like I reached out, I had a patient Thursday that I'm at a loss for how to correct a few of their lab values. And I reached out to Stephen Hussey and I was like, have you seen this before? And he was like, yeah, you could do this, this, and this. And I was like, okay, those are good ideas. And it was stuff that I probably knew, but just hadn't applied to that particular situation. And I'm, it's so great to not practice it in a vacuum because I'm already kind of out there. I always tell patients, look, I have 1 foot in allopathic medicine. I have 1 foot in the functional quantum world. And I try to navigate both. And so I don't completely throw the baby out with the bathwater. I will use medicine when I think it's reasonable and prudent, and the risk-reward ratio to me is favorable, but that's not that often. You know? I think a lot of times medicines, we overreach for medicines, we overprescribe them. And I tell people all the time, you're not going to land a plane turning a trim tab knob. You got to move the lever and work the pedals, right? And same thing with your health. Like taking a medicine is turning a trim knob.
Yeah.
If you're not doing the foundational stuff, which, you're talking about so much on these podcasts, and I'm trying to teach people about circadian rhythm and light, and, the yoking of dark and light and temperature and food timing and food quality and eating seasonally and all these kind of things.
Mm-hmm.
It's like the people that are using Ozempic and they're eating Twinkies and Ho-Hos. And I'm just
Yep.
like, what are you doing?
Yep.
Right. Or somebody that, it's a bad analogy, but somebody that's like, super religious and like, God's going to save me. And they run every red light on purpose. And I'm like, that's not going to work for you. Like, you've got to put the work in, like Jack would say, you got to show proof of work.
Exactly. You have to.
And I think where it's hard is so many people struggle with the motivation.
Yep.
And to me, I always talk about the difference in motivation and discipline.
Yep.
And I think that's something we've really done a lot with our kids around, if you have a goal, if you have an aspiration, there are going to be numerous days where you get up and you're like, I don't want to do X because it's
Yep.
going to stink.
Yep.
But if you can get the first 5 to 10 minutes, there are a lot of times I come in my gym and I'm like, I really don't want to be here. Okay, I'm going to just like do something simple and then I'm going to leave. And then I do the simple thing and I'm like, okay, I'll do one more thing, and then before long, I'm like, man, I just had a really great workout.
Yep.
Right.
Yep.
And I know if I don't do it, it's like when I get in the cold plunge, when it's dark and cold in winter and I'm getting in the plunge and I'm like, why am I out here? Right. The next time it becomes that much easier. So all of a sudden, I'm not doing anything. And I know that that's my mentality. So for me to get up and do something hard, even though I hate it, but I love it, I think getting people to just make those small incremental, I would say quantum packet shifts, like these little shifts, for me, most of the time it's, hey, I just want you to get up and get outside for sunrise.
Yep.
Right.
That's
like explaining like the 80-20 rule. If you can just get outside for sunrise.
Yeah.
And I tell them, I was like, I'm never going to ask you to do anything I don't do. I walk in the morning, I come back, I cook my meat or do my seafood. I sit outside on my front porch, usually in shorts, even if it's 20 degrees. And I face east and I wait for the sun to come up. And so I always, people a lot of times ask me, what do you do? And I'm like, I give them exactly what my schedule is. And then I tell them there's no excuse. I'm like, I have 4 kids in a busy practice and like, I get it done. And it's not in a shameful way. It's just that you can make time for the things that are going to have the biggest improvements in your life. And,
100%.
I'm 51. I'm in, I think, reasonably good shape. I can still dunk a basketball. I can still sprint 200 meters, and had to go back to my office and lay down on the ground and breathe.
Yep.
and then I'd do that for like 5 to 10 minutes because it hurt. And then I'd get back up and I'd see a patient and I'd dictate it and I'd go back and lay down in my office and then I'd get up. And so we were doing like every 30 minutes. But I was back. I had to be like, I had to work. My kids needed to eat, I mean, it's just life. And thank God I could work. So I almost lost my arm. But a lot of what I had done up until that point was what enabled me to bounce back so quickly when I did have to have. And that's a prime example of how modern healthcare is phenomenal. With trauma and infection, like acute health issues, we do a fantastic job.
Yes, I agree.
It's just the chronic disease issue where we've as a culture, we've become so dysfunctional. That's just heartbreaking for me because it just doesn't need to be this way. And if people had a more rudimentary understanding of the things in their lives that are leading to these problems, and we could mitigate it, like we're never going to get rid of technology. It's here to stay. But there, as you and I both know, there are a lot of ways to mitigate these issues.
100%.
I'm known as Doc Hollywood in the hospital because I always have these glasses on when I'm in hospital.
So, ladies and gentlemen, they're blue light blocking glasses that he's wearing right now. Same as what I'm wearing right here. So we're doing our bit because most, like 70% of the light receptors are in our eyes. The rest of it's on our skin. So if all you can do is buy a pair of glasses, then as I said I think it was my last podcast or the one before, $40 pair, $30 pair of blue light blocking glasses. Just get a pair, wear them at night, get a pair that you can wear during the day, whichever one. And that's a good starting step. There are many things that we can do to help ourselves. And I think, it's a testament to the story that you're telling, because this is the story that you're sharing. And the reason why I call it the hero's health journey is tying into Joseph Campbell's hero's journey, which is the background of every superhero film you've ever seen: Star Wars, Superman, Batman, whatever. It's all that hero's health journey. But the reason I wanted to do this is because when we were in tribes, we would have told stories. And there's a thing that I always say to people is like, if we were still in a tribe and we went to our elder or our shaman or somebody, they would say, right, you're not feeling very good. So when was the last time that you danced? When was the last time that you played? When was the last time you sat in stillness? And when was the last time you told a story? There were the 4 things they would ask you. And the reason why storytelling is important is because you get to emotionally, energetically, vibrationally share your experience, which allows that energy, because you have to remember, like, emotion is energy in motion, hence why it's emotion. It allows you to share that with people. So you are now getting emotional feedback, you're getting emotional validation, you're going to get a cognitive solution, but at the same time you are teaching other people, which makes you feel good. So it has that nice balancing effect. And that's why I wanted to bring this podcast to light, because people need to hear these stories. Because as a consultant, as a quantum coach, whatever word I want to use, or an educator, people will say the same thing to me. So how do you do it? And so I'll tell them my story. And it's once I tell them my story, they buy into it. They're like, oh, okay, I'll do that. That makes sense. But when we're just talking about things, oh yeah, quantum, go and see the sunrise, do this, do that. And they're like, oh yeah, it's easy for you because, Mark, you live on your own, you run your own business. It's easy for you. Well, ladies and gentlemen, here's Thomas, who's doing 13 hours a day in a hospital. He's got 4 kids that I have to say he puts probably as much, if not more, love and attention into what they do than he does his own self, plus his wife at the same time. But yet he's still able to do these things. So it goes to show you that it's not the quantity of what you do, it's the quality of what you do. It's not the what either, it's the when and the how. So as he said, if the only thing that you can do is see the sunrise, because that is the most important thing. It sets up so many things in your body to start that the rest of the day is easier. So there are very small things that you can do. And to highlight a point that you said earlier, it's easy to do it when you're motivated. It's very, very easy to do it when you're motivated. And that doesn't really count. It counts when it's hard. Because if you can do it when it's hard, you can always do it. Because life will always have a balance of hard and easy. So if you can always do it when it's hard, if you can get into that cold shower or that ice bath when it's hard, if you can get up and do your gym workout or go for a walk when it's hard, if you can eat well when it's hard and you really just want to eat a brownie or a Twinkie or whatever it is that you want to do, and you say no and you do that thing, you are doing something very, very critical in your mind. You are telling your subconscious that you keep your word to yourself. You promised yourself that you are going to do that thing, and you then go and do that thing. Your brain goes, I can count on myself. I can do those. Where if you say you're going to do something and you don't, you're just reinforcing the fact that you lie to yourself and that you can't do it. And so therefore, then anytime you do try to start something, you will then inevitably fail because it's a fulfilling prophecy. So do the hard thing. As we spoke about at the beginning, like the magic you are seeking is in the work that you are avoiding. So do the thing. It's not a hard thing to do in that sense. It's just start. Like, pick one thing and just do that, and just do it consistently, because success in anything is just consistency over time. Unfortunately, we have been put into a system, medically speaking, that says, oh, problem, here's a pill. Solved. Well, it's not really, because all you're now doing is masking it with that thing. It's like having a leaky boat and plugging it every single time. You can't keep plugging a leaky boat, because you're just going to end up sitting there with a spoon trying to get the water out because there's no more plugs. So eventually you're going to need a new boat or you're going to sink. So you have to then think, okay, so this isn't working. Like, this paradigm clearly doesn't work, because if, I don't want to call it healthcare, if disease management worked, we wouldn't be in this chronic state. We wouldn't have all the diseases that we have. We wouldn't have all the health issues that we have if it worked. And luckily we have people like Thomas, previous guests, myself, who will happen to sit there, go through arduous amounts of hours of going through different types of labs, however many blood panels, however many genetic tests, however many whatever, to try and get to the root cause of what it is that's causing this thing physically. But then at the same time, taking from Dr. Bruce Hoffman's like 7 stages of how you treat somebody, right? Like I'm actually on his seminar later today. That 7-stage model is incredible, because you are dealing with every aspect of what it could possibly be coming from the physical to the mental to the emotional to the psycho-emotional, whatever the case may be, energetically, spiritually, religiously. It covers all these bases. So to think that you can just take that one thing and it's going to go away permanently, you're forgetting, like if you're in your 40s or 50s, it's taken 40 or 50 years for you to be this type of a shit show. So it's not going to be solved instantly. You're going to have to put in the work. And as you've rightly said, you've gone on this trauma retreat. You've done this amount of work here. You've done this amount of work here. Same. Done all of these things because I want to be better. I don't want these things. I don't want to feel this way. I want to wake up every day and be like, this is a great day. I feel amazing. And now I can then teach other people to also feel amazing too. So I think your story encapsulates everything that I'm trying to teach people through this podcast, which is there is no excuse other than, or there's no limitations other than the limitations that you put there. Simple. And if you can do it, if Thomas can do it, anybody can do it.
This is true. Yeah, I think the thing that encapsulates everything that you're saying is pick your struggle.
Yes.
Right. Life is going to be a struggle either way. If you don't put the work and the time in early, you're going to have tremendous struggle on the back end with your health and things related to all that. So you're going to struggle with one thing or the other. I struggle in the gym. I struggle to do cold. I struggle to get up. Like those are struggle, but the return on investment for those struggles is so much higher yield than if I didn't do any of it and was so much older at this point than I would be otherwise, and having so many more health issues today that I would be struggling with. So I tell people a lot of times, you got to pick your struggle. And so your life is struggle. There is no way getting out of that.
No.
You know, people that have uber amounts of money, they have the same problems. They just have more zeros on the end of it. And I've seen this. I have friends that are uber wealthy and I talk to them a lot, and it's the same life struggles. They just have more zeros on the end of their accounts. And so learning how to live in struggle and being comfortable, being uncomfortable is everything, I think. And that's, if you can teach your children, if you can teach friends, if you can teach patients to just start with that, I think people are going to do much better. And again, your point was really well made. I learned that early on in kind of my recovery from trauma journey was whatever I could do that day, just start there. Like there were a lot of days I was unwilling to be willing to do any of the work. That's I remember a really good friend of mine that's a therapist. He was part of the therapy team that kind of helped me work through a bunch of stuff. And he was like, what are you willing to do today? And I'd be like, I'm willing to say I'm effing unwilling to do this today. That's all I can say. But saying that I was willing to admit that actually created a shift. It's like the whole thing around when you ask yourself, what am I grateful for? Even if your dog just died and your wife just left and you lost your job all in the same day, if you can ask yourself, what am I grateful for? It actually changes your brain chemistry in a better way. You don't have to necessarily give yourself an answer, but just asking the question changes us. And so I think learning to sit with the questions is part of what adulting is. Like you said it before we started recording, it's being able to hold two opposing views together, and it can be both and. Rather than either or. A child thinks in either or, an adult thinks in both and. And so it's understanding that. And again, I'm the first to say I have a lot of adulting left to learn.
Oh, we all do.
Right. And it takes a lifetime to live, to learn how to live. But I think just trying to get people to understand that there is a better way. There's an easier way than the ways that some people do struggle. And again, it's not to say you're going to snap a finger or take a magic pill and it's all going to be better. But the way that we are designed to work in the context of nature, I think, is the blueprint for how we need to be living. And the more we get back to that, the better we are, the more optimal we are as human beings.
Exactly. I agree. Because who we ultimately are today is built upon the things that we have previously done.
Yes.
So if we want to be somebody different or better, then we have to take stock in the fact that, well, maybe we're going to have to do some things differently. Because if I keep doing the same things and expecting the same result, as Einstein says, is the definition of insanity.
Definition of insanity. Yes.
So we have to do something different. And that's the hard part then, is people are like, okay, so where do I start? So that leads me to because we're almost close on the hour now. So it's going to lead me to my question for you, brother. When you implemented the quantum and circadian lifestyle to yourself and to your family, or when you're speaking to your patients and you're trying to give them maybe the top 3 things that they can do, which has the biggest ROI for them, what would that be?
So I have a little handout that I give patients, and it's a real simple thing. It kind of covers everything from sunrise to seed oils to food timing, all those things. But biggest thing I tell people is to see sunrise. And I'm like, look, you don't have to see the sun. Where our house is, we're kind of in a little bit of a valley, so I really can't see the sun, but you need to be able to look east. For that first 10 to 12, 15 minutes at sunrise. And I said, ideally, if you can walk a little bit before that, great. If you can also be outside around UVA rise, which typically about an hour later. And then I talk a lot about food and food timing. So the 3 things are basically see sunrise, avoid as much artificial light at night as possible, and do better with your food timing. So we talk about eating within 30 minutes to an hour of sunrise after you've seen sunrise for leptin signaling. And then we talk about like smaller meals throughout the day, and then always eating before dark and never eating after dark. I have a line in there that says, do not eat after dark, period, full stop, period. And of course that gets hard in winter, right? But again, pick your struggle. Like, do you want to lose the 20 pounds that you're trying to lose, or do you want to continue to struggle with it? There's always a trade-off, and there is no free lunch. There are ways to hack your system to get better results with less effort. And that's what you and I and all of us in this space are trying to teach people. It doesn't have to be that hard, and you can leverage your environment to make you healthy, because our environment is what is making us sick. So those are probably the key things. And then people ask me all the time as a cardiologist, like, what to eat. And I'm like, it's really, really simple. Like, we have completely overcomplicated this to the point that it's disaster. I was like, you want to eat seasonally and eat locally. And then we talk about how all mass is light slowed down. Everything on this planet that's living comes from sunlight. And when we eat food, it has a barcode on it. And that barcode is written in the electron and proton information in the food, and your mitochondria read that barcode and they make adjustments based on that. And if your latitude and longitude, predominantly your latitude, don't match the food, then you space your mitochondrial proteins, you create inflammation ultimately. And so, I tell people eating a pineapple in Nashville in winter is a really bad idea, and here's why. And it clicks. I was like, if you can't find it within a 30-mile radius of where you live, you don't eat it. If it does not grow here, you do not eat it. And I said, it's real easy. You just go to a local farmer's market and sign up for a community-supported agriculture, and you'll get the seasonal fruits and vegetables that your farmer's making. Support your local farmer. You know what he's putting on the food and in the ground. And same thing goes for your meat. If you can get local meat, that's much better. And I said, that's how we lived until 1950, 1960, when World War II, we created refrigeration, and all of a sudden every meal in the grocery store comes from 1,500 miles away. And if you assess it with a photometer, it's dead. Right? And so, food does matter. But to Jack's point, light trumps all of it, because food is just crystallized light. And so you have to match the light in your environment with what you're doing. And when you do that, you're coherent. And when you're coherent, everything works better. And I think that's the thing that's just, again, like, none of this, all the stuff we've talked about today, none of it was taught in medical school. Now, some of it's being taught, right? Some of the stuff around emotional IQ and neuropsychoimmunology and gut health connection, brain health connection, like all those kind of things are starting to be taught. But it's not mainstream. It's not. Doctors don't routinely address those issues. The primary care doctors are completely overwhelmed. I mean, I honestly think they should be paid the most. I think the things that they have to deal with, and the metrics that they have to meet, and all the BS that insurance puts on them is just complete bullshit. It's why so many of my friends who are primary doctors are leaving and doing concierge practice. They're fed up, and they are so. I have a literally a large handful of friends who are primary physicians who now do they went from 4,000 patients to 400, and they take really good care of those 400. Those 400 people are willing to pay for it. They enjoy the care that they get, and it's a win-win.
Yep.
And I think that system, as long as it's allowed to work, is great. And we've got to figure out a way to provide for people that don't have the access to that. And I think that's the thing that we could leverage is all of these quantum principles would go a long way to reducing our costs and improving our healthcare system.
I agree.
To kind of bring it back home, I'm involved in an entrepreneurial group here in Nashville. It's basically a mutual fund for startups. So you put your money into this investment fund, and it distributes it around to 30 different startup companies that we pick every year. We have 30 new companies that come in. They're valued between 2 million and 4 million, blah, blah, blah. So I was talking to a group of about 30 founders, and they were picking my brain about different things in healthcare. And one of the moderators was like, what do you think about this idea? Hospitals are disappearing, and we've got to grow hospitals. So like, whoa. Like, listen to what you're saying. Mm-hmm. What is the point of growing a hospital? It's to take care of more sick people. Mm-hmm. We want to get rid of hospitals, right? We want hospitals to be a thing like, oh my God, you have to go to a hospital? Like, you must be really sick, because that rarely happens, right?
Yes.
That's not the way our system is. Why? Because everybody gets paid a lot more when somebody goes in a hospital. What's crazy is in like South Korea, the doctors are penalized when their patients are hospitalized.
I did not know that.
To your point earlier, incentives drive outcomes.
They do.
Right? So if we had a different incentive system, it might make a difference on what we spend on healthcare. It's the same thing with me. If I see a patient in the office and I spend 3 minutes with them, but I increase a blood pressure medicine, I can charge a higher level care and get paid more than if I spend 30 minutes with them, give or take, we'll say 25 minutes. Because you can bill on time. Most people don't, because that's tough. And I can't charge as much. So when I do all this counseling and therapy work and everything looks good, I don't make an adjustment, I don't see as many patients in a day. I see literally about half. So I see roughly 20 in a day. Some people in my group see 40 in a day, right? True. So I see half as many people. I spend a whole lot more time with them, but I can't bill any higher level than the other people, and they're seeing twice as many people, right? So, and again, I'm not impugning them either. They're doing a good job. They're just focused on a very small thing. I'm trying to cover a lot of different aspects because I'm really trying to help people be healthy, not just fix a blood pressure or fix a cholesterol number on a lab sheet. And I think the system doesn't incentivize or reward that. No. And so for me, when I look at it, I'm like, I'm adding a whole lot more value for this than what I'm getting in return. But it's something that's really important to me because I'm trying to throw a bunch of pebbles into the lake and change and create ripples to a lot of different people. If I can teach 5 people and they embrace it and they learn it and they share it and then it grows, then I've had a much bigger impact than just the money side of it, right? Exactly. And that's, again, getting back to the thing that I said earlier about my sense of injustice and wanting to fix things for people and wanting people not to suffer. That's a lot of what drives it for me. Yeah,
that's beautiful, brother. And we need many, many more people like you. We really, really do. If we could clone you, that would be fantastic. Because my wife would
say, "No, you don't need more like me." But yes,
well, we won't let your wife in on the decision. We'll just be like, we're just going to go over here for a minute. We'll be back.
No,
and then we'll just clone you. But Thomas, brother, thank you so much for sharing your story. I think this is going to impact even more people because of how honest you have been, how authentic you've been, and just the genuine love and care that you've put through this podcast. I can feel it energetically. I see it in your face when you're talking about it. And I know that the outcomes that you are after are going to come from the efforts that you put in, because that is what happens. The more value we give, the more value comes back out. And I think that's a truly, truly humbling and beautiful thing that you're doing. So I just want to say thank you for your time, because again, I know that you're a busy man. So ladies and gentlemen, where can they reach you if the people want to get in contact with you, if they want to speak to you? How can they get in contact with you?
I really, it's a great question. I have not really embraced social. I'm not even on X, although my boys are because of their recruiting, and my wife has to snapshot stuff and send it to me. I'm on Instagram at Thomas Cabell MD, but I've got like one post right now.
That's so good.
I've been avoiding social media just because it's another
It's another thing. Yeah.
It's another thing in time. There's a above average chance in the future though that I'm going to try to start putting maybe like an email newsletter together. The whole goal there is just to raise awareness and teach people like small hacks, small tips that they can apply to their life to try to be healthier every day, every week.
Beautiful.
I've had a lot of demand for that. My patients are always like, where can we learn more? How can you teach me more? And I'm almost like, well, and I finally have realized I can leverage knowledge and create something that more people can tap into. So instead of helping 20 every day, I can maybe help 200. So that's the goal. Yeah.
I'll tell you what, once that's done, I will update the description with whatever it is that you set up, whether it's a website or a Slack channel or something. I'll add it to the description.
It's probably going to be a Substack. It'll probably be Substack.
Okay. Yeah. So once you've got that going, I will add that to the description below so people can find you.
Sweet. That'd be great.
No worries, brother. Well, listen, thank you again so much for your time. Ladies and gentlemen.
Man, it's been great to see you. For sure.
Oh, mate, it's been amazing. Absolutely amazing. I'm so grateful that we got to meet in El Salvador and we've managed to keep this connection. And I know we're going to do some great things together moving forward. So ladies and gentlemen, this is Thomas Cabell. And until next time, stay blessed. I'll see you soon.